So my presentation's on diabetes, the silent epidemic. I'm Yuvraj Walia, a rising sophomore in California. Since a young age, I've always been interested in medicine and hope to become a doctor. I'm the president of our HOSA chapter and co-founder of the Student Society for Regenerative Medicine, which aims to connect high schoolers across the country with health professionals and mentors. Moreover, I was responsible for outreach to California voters for Proposition 14, which was a bill that renewed billions in funding for stem cell research passed last year. Finally, I love speech and debate and compete at some national tournaments. For a roadmap of this presentation, first we look at the basics of diabetes, then the inequities it exploits, some interventions to eradicate the disease, and then finally, relevant natural product research. So diabetes is essentially hyperglycemia, which occurs when there's an overabundance of glucose. There are two types, type 1 and type 2, which both affect insulin, the hormone that regulates our blood glucose. In type 1, there's no insulin being produced, but in type 2, insulin is produced, but the body cannot efficiently distribute it, resulting in too much glucose in the blood and not enough actually getting into the cell. The graph displays the rapid increase in diabetes, and the diagram on the right shows the pancreas, which is supposed to produce insulin in a healthy body. And this compares regular absorption versus type 2 diabetes. Notice in type 2, although the insulin is produced, the insulin receptors that allow the glucose to enter the cells malfunction, preventing penetration and forcing the glucose to collect in the blood. These receptors usually malfunction when people don't exercise or have an excessive body weight, which is the main cause for type 2 diabetes. Next, what is the relevance of diabetes to global health? Global health is definitionally a field that places a priority on improving health and achieving equity for everyone. Diabetes fulfilled all of these requirements. It is rampant in almost every nation, definitely affects one's health, and unevenly affects people based on race, ethnicity, or income. And this is a brief worldwide distribution of diabetes. Notice that 95% of cases are preventable type 2 diabetes, and nations with the greatest prevalence of diabetes can be either developed, like the US or China, or still developing, like parts of Africa and Asia. And the next graph shows a more complete picture. Here, the world overall will see a 51% increase in diabetes, and special regions such as Africa, Middle East and North Africa, and Southeast Asia will see even more future cases. And then finally, these are some quick facts. Diabetes diagnoses have horrifically quadrupled in recent years, and 463 million adults are tragically living with diabetes today. But the future is not much better. 2 out of every 5 people will develop diabetes in their lifetime, largely due to undiagnosed cases. And by 2030, diabetes will unfortunately be a leading cause of death. The epidemic status. An epidemic is a sharp increase in cases in a specific geographical area, while a pandemic is an epidemic but on a global scale. Looking at the exponential infection rates for COVID-19 and the swine flu, it is clear that diabetes mellitus is on the same path to pandemic status, even though it's reaching less people and not the center of global attention. Let's shift our focus to the inequities that aid the spread of diabetes. The first is systemic racism, which affects things like housing opportunities, which are limited and often near landfills or heavy pollution. Moreover, medical professionals prescribe and treat ethnic groups differently, which can impact the quality of care that they receive. In fact, healthcare at all is a privilege because minorities disproportionately lack access to healthcare. The 2 graphs on the right show that Native Americans, Hispanics, and Black Americans are the 3 groups most likely to lack healthcare, and unfortunately, the 3 groups also most likely to develop diabetes. And finally, implicit bias affects how we perceive the occurrence of disease in different demographics, the stigma associated with it, and how we respond. For these reasons, there's a shocking 77% higher risk of diabetes among Black Americans, with a similar number for Native Americans. And the second inequity that aids the spread of diabetes is between least developed countries, or LDCs, and high-income developed nations. The healthcare landscape in LDCs is completely different. For one, there is a general lack of awareness about health, whether that be from a safe diet or basic hygiene. Secondly, development factors such as urbanization and migration prevent residents from adopting a stable lifestyle, for there's always change going on. And while some areas are urban, others are rural. These rural areas lack internet, nearby hospitals, and beneficial living conditions, which greatly impact their health. And finally, in developing countries, health as a whole is painfully neglected. On a personal level, it is difficult to visit the doctor when your family's lives could depend on food on the table that only comes when you attend work. And on a national level, governments often fail to adequately spend on social services, unfortunately excluding millions from healthcare altogether. So even though diabetes is equally prevalent in most nations, 80% of mortality occurs in low-income nations, which the 2 graphs on the right show. Many of these deaths could be prevented had patients been diagnosed earlier. Next, let's look at some solutions. Awareness initiatives allow people to monitor and take control of their own health. For example, the International Diabetes Federation's World Diabetes Day is celebrated in 160 countries, making it the largest awareness campaign ever. Nonprofit organizations also have a role. We must continue to increase awareness about DM. Secondly, we need to increase the quality of preventative care. The UK, Denmark, Australia, and Canada all have low rates of diabetes and specific resources to care for patients. Notably, these countries also have universal healthcare systems that the US does not. And finally, access to care is the single greatest contributor of inequity and late diagnoses. We need to ensure, whether through universal healthcare system or reforms, that we have systems to cover marginalized groups that currently lack access to care. And on the individual level, there are lifestyle and diet modifications you can make to lead a healthy life. For example, you can cut down on carbs, frequently drink water, and avoid becoming overweight. In the workplace, don't be sedentary, exercise as much as possible, and remember to keep yourself informed so you can be in charge of your health. And for the last part, let's look at some relevant research. The problem is that current diabetic treatments have debilitating side effects such as nausea, diarrhea, nerve damage, heartburn, or abdominal pain. A viable alternative is products found in nature, which also have properties that allow them to treat diabetes. In my experiment on parasitic roundworms, I compared the effects of bitter melon, a natural product, to the effects of metformin, which is an official treatment. On the right, there are pictures of the organism we tested, the SDS page, and the Soxhlet extraction. Surprisingly, the results indicated that bitter melon was just as effective at reducing blood sugar as the official market treatment metformin. This has important implications on people in low-income countries that cannot afford actual medicine, but can use treatments from their natural surroundings. Several other authors have corroborated the finding that natural products are effective, for example, these people. And this is what some experts have said on the topic. Dr. Kumar's ideas, especially on the far right, bitter melon may be a feasible option for ethnic minorities who have a high prevalence of diabetes but prefer treatment based on natural products according to their cultural beliefs, is a key cornerstone on how bitter melon can break barriers for ethnic groups that prefer natural treatments. That's especially important. In conclusion, it is important to recognize that diabetes is not the next pandemic. In fact, it's already here. Diabetes has been overlooked for far too long. The failure to adequately eradicate DM illustrates the profound inequities, both race and income-based, that hinder global health progress. Ways to bridge this gap include international policy and affordable and safe natural products. Despite its meteoric rise, diabetes can be prevented with a healthy lifestyle on the individual level or international policy on the international level. You can keep yourself informed and get involved to ensure that you can help others that are facing similar problems. These are some references I cited in my presentation and some acknowledgement. Firstly, I'd like to thank the Global Health Leadership Conference and Johns Hopkins University for providing me with the opportunity to speak about an important worldwide issue. Additionally, I'd like to thank you, the audience, for listening and hopefully taking action. And this concludes my presentation. My contact information is listed here, email, my phone number, Instagram, and Facebook. And again, thank you so much for listening.